Omicron isn't spreading as fast as predictions warn, as half of London's patients diagnosed with COVID after admission. A leading COVID expert revealed half those patients in London's hospitals were only diagnosed with COVID after admission with another condition, as the rate of admission may be slowing down. The current data has led to fears that hospitalizations are following the exponential increases seen with cases in recent weeks. Cambridge professor Sir David Spiegelhalter claims that overall admissions to hospital should remain manageable, as the rate isn't looking quite as bad as once thought. If the rise in COVID cases in hospitals was because people were becoming severely ill with Omicron, numbers could be expected to continue to increase quickly. But if rising hospital admissions are happening while a higher proportion of the public has Omicron and some of them end up in hospital, then numbers may not rise exponentially. Sir David told Channel 4 News, "People are going to be watching London very carefully over the next few days, which has had a huge surge in Omicron, doubling every couple of days. But their admissions in London, the speed by which they are going up may be slowing down. It's not looking quite as bad as it was in terms of the speed of increase." He added, around half the extra admissions in London with COVID were in fact diagnosed with COVID after they had been in hospital. In other words, they had COVID anyway, which vast numbers of people in London now do, and then they found out they had COVID once they'd gone to hospital. Figures published on the NHS England website show there were 1,248 patients in hospital with coronavirus in London on December 14, but only 963 of them were there because of the virus. Sir David said was very difficult to say where hospitalizations would ultimately end up because of the uncertainty in the Omicron models. The Sun is also urging readers to sign up to the Jabs Army campaign to make the rollout as smooth and fast as possible. A booster shot is the best protection against Omicron, with early data suggesting it pushes efficacy back up to 75%. Dr. Jenny Harries, UKHSA chief executive, said, "Once again, we urge everyone who is able to get a booster jab to come forward and do so. It is the best defense we have against this highly transmissible new variant."